again to the inaugural episode of Compliance Deconstructed, brought to you by Simply Compliance and three awesome, amazing compliance professionals. I'm Jessica Zeff, accompanied by my hosts, Lorie Davis and Elvan Baker. We're starting out our first podcast, so hopefully you can help us celebrate. And what we're hoping to achieve with this podcast is really have a little bit of fun while we're talking about a subject that we know and love very well, healthcare compliance and regulatory compliance. And yes, we are really passionate about our subject, and we're hoping to share some of that enthusiasm with our listeners. You can be a compliance professional who's in the field every day, or you can be somebody who's interested in learning a little bit more about what healthcare compliance is all about. So with that said, we're going to take a moment to introduce ourselves. I'll kick off and then I'll hand over to Lorie and Elvan. So my name is Jessica Zeff. I'm a host for this podcast. I've been working in healthcare compliance for almost 25 years. I've worked on the provider side. I've worked for health systems. I've worked in Medicaid, Medicare, you name it. I've probably seen it, done it, and really enjoyed it. I've stayed in the space because I love it. There's never a dull moment. There's so much going on. And the field of healthcare compliance really tests you. And that's something that I enjoy and that's important to me. You're always doing something new, hence this podcast. All right. With that said, I'm going to hand over Lorie or Elvan. Who wants to go first?
I'll let Lorie go first.
All right.
Okay.
All right. Well, thank you, Jess. I am Lorie Davis. I have been in healthcare just over 8 years. I just celebrated my 8-year anniversary, in fact. I have spent the majority of my time in Medicaid. It is my passion. I love Medicaid. I tell the story that I started out in riches and now I work at the other end of the spectrum. I used to work in luxury goods when I started out. I have over 25 years of international project management experience, and I fell into compliance and I absolutely love it. And along the way, I also did Medicare, CHIP, ACA, commercial. I've done a lot and I've learned a lot. And so I'm really excited to do this podcast with Jessica and Elvan, just to share what we learned, talk about what's going on in trends, and celebrate all of that good stuff and maybe not some good stuff with all of you. So Elvan, I'll turn it to you.
Thank you, Lorie. This is Elvan Baker. I've been in healthcare compliance about 5 years now. Prior to that, I'm a clinician by trade, and I've been in clinical and operational roles, mostly in subacute senior living and rehab settings in variety of the verticals. And the last 5 years, I've been in variety of compliance roles, from giant contract therapy company conglomerates to right now a digital health tech startup. And I am really excited to talk about compliance because it affects all parts of our lives, whether we are a professional who are within the profession itself, or a provider, or a benefactor. It affects all of us at all parts of our lives, whether it's healthcare and other types of compliance. It's a passion of mine, like the two other ladies. I do believe that we have the rules and regulation to protect us. It's nothing to be scared of. It is there for my protection. I believe it as a patient, and I want everybody to believe it as a provider, patient, company. I think that's the only way we're going to get ahead of the game. That's that.
Woohoo! So between us, we come with a lot of experience and a lot of different perspectives. So Lorie, something I wanted to ask both of you actually, what do you love about compliance? So we're clearly very excited and enthused, not just about this podcast, but about the content of the podcast, that we get to share it with others. So what about compliance excites you and has kept you going?
Guardrails. I see compliance as a guardrails, and But like I said previously, just like guardrails protect us on the road, I think compliance is there to protect us from harm, whatever type of harm it may be, emotional, physical, financial. It is there to protect us. And that's what excites me. And the ability to talk to people and let them understand why it's there, because the more people get to a place of natural being within a compliance space, the better outcomes we get out of our programs.
And I know what you mean. I mean, I would put it slightly differently. One of the many reasons I love healthcare compliance is because I knew I can't be a clinician. Like you say bodily fluids, and I near about pass out. So I knew being a nurse or a doctor or a therapist really wasn't going to be me. But I wanted to kind of help people somehow. And it's those guardrails when I thought, okay, well, how am I going to help people? It sounds cheesy, but it's what I wanted to do. And if you follow my career, you can see I might not have been a social worker, but I found my niche in healthcare compliance. And once I worked in healthcare and I found this thing called compliance, I was like, wow, I can work in the background and I can help people that way. And I can help look at those guardrails and also look at, efficiencies and patient safety. And that really was important to me. And I know that that's been important to both of you as well. Lorie, what keeps you going? This is separate from our conversation that we're going to have later about the 7 elements, but why? What keeps you enthusiastic about this field?
Yeah, I have to say, I love that no 2 days are ever the same. And I love the fact that I need to know enough about the entire business to be dangerous, but I don't have to be a subject matter expert. So that when my friends in the service center call or appeals and grievances or claims, I can speak their language and help them understand what's going on. But I don't necessarily need to be the subject matter expert doing that job. And I like what Elvan said about being guide rails, but I also think about it as we're the bridge. We're the bridge
Mhm.
very often in my world to the regulators. So the regulators are saying, "Hey, we're adding this coding, or we're taking this coding out," and our job is to be the bridge to help them prepare for that. Or when there's an external audit, we're the ones on the sideline being the cheerleader, being the coach, saying, "Hey, you know this business better than anyone," and really getting them there. And so in that, I really like that opportunity where we don't have to be the enemy. We're not the enemy. I know a lot
That's
of
right.
times when they see, and I've said this to you, Jess, they see compliance coming and they dive under the desk. I don't
Like you
want to.
smell like garlic. They
Yes.
way slowly.
Yes, they do not, they don't want to see compliance coming. I want to change that. I want to be the person that they pick up the phone and saying, "Hey, Lorie, something's not right. Can I talk to you? Can we just have a conversation?" I want to be that person for compliance. And so that's where I get a lot of energy and passion, is building those relationships and being the bridge.
Yeah, and the 3 of us have talked about that. We're very energetic in that, and we get
Mhm.
energized by those kinds of challenges. And honestly, sometimes it's uncomfortable, right? Because we have to learn on the fly very quickly as we go while we're building relationships. Sometimes, you have to develop this experience somehow, right? And the thing about healthcare compliance that both excites us and scares us is that there's so much of it. So you can't learn all of it.
Mm-mm.
Or you can't learn it in one go. It really does take a while to build that experience. And actually, when the regulations change, I mean, you still can't always be 100% sure. You've always got to be checking and learning. And that's part of the excitement too, even with the discomfort that you sometimes get, that position sometimes brings. But I think you get better at it and you learn to accept, actually it's okay, it's part of the job. That's what working in compliance is. You have to be comfortable with change,
Mhm.
comfortable with discomfort, but also your willingness to learn and to work with other people as well and lean on their expertise. So
Absolutely.
yeah, there's so much going on. So with that said, I started to say earlier, it's really interesting. Lorie, you're coming at this from a Medicaid perspective, and we don't often get to hear from somebody who has Medicaid expertise, right? I'm coming at this from provider and health plan, and even from tech companies that I've worked for, and the compliance expertise and the privacy and all different aspects. And Elvan, you're bringing a whole history. I know you haven't, you were a bit concerned when we spoke yesterday that you haven't been in the field quite as long as me and Lorie. And yet I would consider you an expert from the conversations we've all had. You bring a lot of knowledge, as much as Lorie and I could bring. So I know you're not you're not always quite as confident, but you do have that knowledge and that expertise that you bring. And that makes us a really well-rounded group. But that really plays well for those of you who are listening. Like, this was intentional. So we came together with an idea, and what we would like to do is be able to have real conversations about what compliance means, what some of the challenges are. And we are hoping that with the expertise that we bring from our different perspectives, we can, talk about everyday challenges that compliance professionals are dealing with every day. So before we embarked on this adventure, Elvan, Lorie, and I, we listened to a host of different podcasts on compliance. And don't get me wrong, they serve their purpose. There's some great podcasts out there. But what we found was we weren't sure that the issues being discussed were the same issues that everyday compliance professionals like us were dealing with. And I really have a thing. I mean, to be honest, Lorie and Elvan, I don't know if you'll agree, but working as a compliance professional can be really lonely. And sometimes you feel
Absolutely.
like you're the only one pointing out a particular risk, and you feel a lot of pressure to cave, and you know that you can't, but that makes you lonely. Even though you're in an organization, you might be surrounded by colleagues, actually your role is very different. I have always found it beneficial to liaise and network and work with other compliance professionals. It's less lonely. You get a bit of a head check. Am I going insane? Have I totally missed, the point of the exercise? Like, am I mistaken? Maybe I need another perspective. And I have consistently found that actually having colleagues who can back me up or act as a sounding board can be really, really helpful. Lorie, Elvan, would you agree?
I think so. I think so. I think there's enough perception about compliance being run by these people who only say no, and it's either a black or white. Not to say that there isn't. There are some parts of compliance and certain issues where there's a black and white, but it's always like this dark place where it's a no and it's very serious, and there is no give. And I found in the podcast that I listened to, well, like you said, they serve their purpose. I'm like, but this doesn't sound like the way that I like to run my department. And this really doesn't. They basically said, this is the rule, this is the interpretation, this is how it's going to happen, and the conversation is over. I'm like, yeah, but there are other 200 other variables in the picture for me right now, never mind what's going to come tomorrow from the field. So I would like to think that we will provide the audience with an opportunity to see that there are many ways to skin this cat, and sometimes we're picking the best option out of a whole lot of bad. And we're trying to do our best, like you said, connecting with other humans and not be so lonely in that place. So I'm hoping that this podcast serves that purpose to people, to be able to say, number one, it's not a department of no all the time, that there's some lightness to it and there's some humor to it, and that there's compliance officers out there who accept that the answer that's a no today may not be no tomorrow, and it may not be no due to another circumstance in 2 days.
That's right. And Lorie, how about you?
Yeah, I think Elvan just picking up on that thread, I think it's helping the business owners and leadership understand the risks. So it doesn't necessarily have to be no, as long as you understand here's the risk of
You
by
got
not
it.
doing or by doing XYZ, this is what could happen. And as long as everyone agrees that there's a risk, there's a possibility, it does not have to be no. I find compliance to be a very supportive community. Again, I try to come with a very positive attitude where possible. Sometimes things happen and people do things, and it's okay. I understand. Let's keep going. Let's figure it out. And again, let's go back to that risk. Now this has happened. Here's what could happen. And you really just have to have that conversation and be as transparent as you can in your compliance. When I think about Medicaid, thankfully Medicaid and CHIP and even ACA for some of the states with exchanges, they have agreements and they give you those guardrails. But oftentimes in Medicaid, it's not what's so much what's in the agreement, it's what's not in the agreement.
Yeah.
And you have to read lots of bulletins and notices and other supporting recommendations or guidelines to help you. So it is a lot of research and things like that. And for someone who's a lifelong nerd and learner, I enjoy
Yay,
that.
nerds!
I am definitely a regulatory nerd. My idea of a good time is reading a Medicaid contract. Please don't judge me.
I think you're among friends. It's safe to say, Lorie.
But I think when you're working with your business owners and they instead of them understanding, I'm not saying you can do this, here's why I'm saying you can't do this. This is the section of the agreement. It says you have to be open for these hours, you have to respond in this many days, or whatever it is. You can give them, Elvan, to your point, that black and white. It's not always gray. And if there is some gap in the interpretation, which very often there are gaps, I think it is a matter of, again, talking to leadership. At what point do we want to go back to the regulator and ask a question? You may not necessarily want to, because they may say things like, no, and you don't want them to say no. So you have to think about, that's a risk in your discussion. So I think you have to be open to that risk and reward, or risk and penalty. So again, it's just communicating. But again, that's why the partnership is so important with your business areas or your stakeholders or whatever you call them in your organization. I've always called them business owners because that's my world, but I know a lot of people call them stakeholders. But those are your partners, those are your peers, and you want to make those people your friends, not your enemies.
And thanks for that. I mean, you've spoken very eloquently about why we're here. So it's all of these issues. And when we talk about other podcasts, compliance podcasts that we've listened to, they are good, right? There are some that maybe aren't, but the most, I think are pretty good. But they're speaking either at a different level or they're speaking at a very different audience. And what I want is through this podcast, like I said, to talk to everyday compliance professionals and talk through really what compliance means and how you maybe do compliance in the way that you've both spoken to. And I don't think that those kinds of everyday issues or challenges are addressed in some of those other podcasts. So whether you're a compliance professional who's looking for community, who's looking to maybe better understand, well, how do I get through the day? What are some of the challenges? Or maybe you're a compliance professional looking for a bit of validation or even a bit of guidance. Hopefully, there's some learning and sharing that we can do with our listeners. Or whether you're somebody who, has just heard of compliance or even never heard of healthcare compliance, you just want to know a little bit more. This podcast should give you a little bit of a taste of what we mean when we say healthcare compliance. It's not really just about the rules and the regulations or assessments. There's so much more going on. So I have had lots of people say, well, what is healthcare compliance? And the truth is, yes, you can trot out a kind of summary, like, I get it. but it doesn't really represent the full breadth and scope of what a compliance professional will do. So I had to laugh. I was on a call yesterday with the client and they wanted me to do an audit. And they said, "Oh, well, you'll do this audit, but are you able to do an analysis and a report of an audit?" And for a moment, I sat there a little stunned and wondered if it was me and I had mistaken, did I get something wrong? Because I'm forever wondering, is it me? Do I have the problem or is it someone else? So I thought, and I said, well,
It's someone else.
someone else. I don't know how to answer that on, in public media. People might think I'm a little bit narcissistic and I'm really, really not. So, but I sat and I said, well, be auditing isn't just about looking through claims or files or documentation and filling out a little spreadsheet. To me, auditing is about taking the data and the evidence you've collected, doing an analysis, and then, putting together a report, identifying the risks, and then developing some sort of corrective action plan or a strategy. And the client looked and said, "Oh, I didn't realize that." So, I mean, I'm always, and that's just a small example of people not understanding what we do. So, for those of you who are very new to the healthcare compliance field or really haven't been involved at all, you just want to learn a bit more, hopefully this podcast will be helpful to you. So, with that kind of introduction, and boy, can we go on about our field, I tell you. But that brings us to an interesting question. So, this is an inaugural podcast, right? And so, we want to kind of start at the beginning. So, in healthcare compliance, where on earth might we start? Well, guess what, folks? We've got the 7 elements of compliance. Are we able to name those 7 elements? I should explain first, right? So, any kind of compliance program, whether it's healthcare or any other industry, the idea of a compliance program will be based on what's called 7 elements or 7 criteria, 7 buckets, whatever you want to call them. Right. So the test for us is, and these are the standards that healthcare compliance professionals will work towards, the 7 elements. So when you build a compliance program, you're using the 7 elements as kind of an infrastructure, a guide as to how you're going to build your program. So what are the 7? What was that?
Blueprint?
Blueprint. That's a good word. That's a good word. Yeah, there we go. Okay, so we use the 7 elements of compliance as a blueprint for setting up an effective compliance program. So what are those? We're going to put ourselves to the test. All right, what are those 7 elements? Let's see. Leadership and governance.
Yep.
Do you want me to read it?
Policies and procedures.
Do you want me to read it? I'm ready.
Procedures. Oh, you go, Elvan, because I've been talking a while.
All right. Written policies and procedures, compliance leadership and oversight, effective training and education, effective lines of communication, internal monitoring and auditing, our host's favorite, enforcement and disciplinary guidelines, prompt response, and corrective action across the board.
Okay. Yay, we did it. All right. So all those years of compliance knowledge, and we've got those 7 elements.
Yeah, but nobody questions us. That's the point.
Well, I know. So a question that Lorie came up with when we were talking yesterday, and I never thought about it, but it really, speaks to maybe some of our individual preferences. But what's your favorite element? Does anyone have a favorite element? And I'm not kickstarting this conversation because I've been gabbing away. So who wants to go first? Anyone
Lorie's
have a favorite element?
Mine are at the bottom. Lorie's going.
So I love.
If you disregard Lorie, go Lorie.
I love policies and procedures, and regulatory guidance often leads into that. And those are 2 of my my big areas, managing an effective policy book that gives you those guardrails that Elvan had talked about. And it really starts the great dialogue. And very often when our friends that are external auditors, which is another one of my things, is monitoring and auditing, I love that they ask for policies and procedures and they want updated ones. So some organizations say, oh, once every 2 years, once every 3 years. Oh, we don't need to update those policies. They're fine. You should be looking at them once every year. That's right. Every
But
year.
Lorie, why? Why is that so important?
So, if I think about something as big and as broad as the Medicare final rule, that comes out annually. Very often, Medicaid updates their agreements annually. So, when you're doing it, you should keep it fresh. You should keep it current. There are some people and some organizations where they literally look at every policy every 6 months. That might be too often, but you have to find what works. But at minimum, and the OIG, the Office of Inspector General, their guidelines say once every 12 months for policy reviews. So I
Right.
think we should mirror what our federal regulator is saying to us. So that's the standard that I have always worked with, and that's why. So again, I'm a big fan of policies and procedures. I don't want to buy your policies birthday candles. There was a time where I had some policies in my policy book that I needed to go buy 10-year birthday candles
Oh my
because
word.
they forgot that this policy even existed. It was a disaster recovery policy that had been introduced. They hadn't looked at it in 10 years. It literally told people to go to this place that no longer existed.
I was going to say,
it
you have
had
to go back to 1972
I
in
know.
it had
time.
like literally the building had been demolished, but that's where they were telling people to go, to contact specific people in the organization that had not worked in the organization in many years. So again, and I think sometimes when you have a normal organization, there's turnover that happens. That's normal. And so when you're taking inventory of all the things you need to do, sometimes the last thing on your mind are your policies and procedures, but I think they should be your first thing because they are your roadmap. They are your blueprint and they set the tone. They should be, somewhere between a desk level that's really detailed and, that high level guidance that you get from a regulator or, your external entity or whatever your source of truth is. But it should give you a good way to work and tell you
I,
what to do and when.
And
I
this is
think,
interesting.
oops, sorry.
Go ahead.
I think organizations forget two things from my experience. They either forget what policies and procedures are there for. They're the instruction manual for staff, to control and make sure that behaviors are consistent and things are happening the way that you would expect them to. And also, working with a lot of providers and organizations, they see policies and procedures as being just another bureaucratic hoop. And that's all they see them for, not really realizing that actually it's good for their business. It is a regulatory requirement. But actually, having written policies and procedures that are kept up to date make sure that your workforce works in the way and produces the outcomes that you're expecting. And if you don't have those, then actually you might not be working as efficiently or effectively or as safely as you may have wanted. It's also very difficult to measure outcomes. It's difficult to discipline then when things go wrong because you didn't provide a set of instructions to begin with. So not having those policies and procedures isn't just a bureaucratic hoop. It's really a safety net, is how I see it.
Agreed.
No,
Two
don't
things I thought
apologize.
about this. Your policies and procedures, it's meant to be a living, breathing, evolving document. That's to me number one. But the other thing I was thinking when Lorie was talking about It's the guardrails, it's the blueprint. It's also, we as clinicians, we're always told if a tree fell in the woods and nobody was there to hear it, did it really fall? If it's not written, it didn't happen. If
Yeah.
it's written, now it's out there. You cannot hold people accountable to something that is not there within their reach.
Absolutely. And I think, again, when I think about my friends that are regulators or auditors, a policy can really help diffuse a potential concern, or it can help answer a question. So they're doing an audit, they find something, they look at the policy and see what the policy said. Sometimes it could be as easy as rewriting a policy or updating a policy. Whereas if you don't have any policy at all,
That's
just
right.
to your point, it can cause a lot more confusion and concerns. So I think policies are that safety net, exactly what you said. It really can help when you're in that audit situation.
And another thing, if you don't have your own policies, regulators have a right to go to the next level of what is out there for you. So you
They
create
do.
your own policies to protect yourself. Of course, it needs to comply with a bigger picture. But if you don't have that, they have at a state level, we don't have anything in a state level, then the regulator has a right to go to the federal level.
Yeah. Mhm.
Same thing with the law, right? I mean, we have a lawyer with
Yeah.
us, right?
Yeah.
Jess?
Yeah.
Genuinely, I mean, if there is a blank in whenever there's a gap, something will fill that gap. Don't let there be gaps. Write it down. Write
Mhm.
it down.
You can
Right?
solve your problems better than they can. And it's
Yes.
better you told them, hey, we found something and this is what we did, than, oh, I didn't know we had a problem. Do we need to go fix it? Don't put yourself in that situation. Exactly what you said, Elvan.
Jess,
So,
what are your favorite ones?
well, wait a minute. I was going to ask first because I've been writing these policies and procedures for days now. And I normally get a bit of a break, but it's a client who just needs a lot of help setting up a compliance program and conditions of participation. And I just wondered, so Lori's saying how much she loves policies and procedures, right? And the management of it. And she understands why. Be honest. Who loves writing policies and procedures? You do?
I'm a nerd. Of
Yes,
course
so
I
am
do.
I. You too?
I
No,
do.
I'm just blinking to her.
I
To say I don't. I mean, I do it all the time. It takes a lot of effort. So it's not like policies and procedures. You can just kind of crank them out, right? So I've heard people, we're going to talk about AI in another episode, but they just, type something into AI and they think that they cranked out a policy and procedure. Actually, it takes a lot of thought and resource and, liaising with different stakeholders to put in place an effective policy and procedure. So I love the end product because I know how much effort has gone into it and, I can be really proud of it, but it does take a lot of work.
But at the same time, this is a great opportunity to break down a barrier or a silo,
Yes.
depending on the organization, right? I
Right.
have my prior authorization policy for my department, but I need to go talk to Elvan to make sure her team's doing something. I need to talk to these people over here in this other department. I need to talk to you, Jess, about what your department's doing. And our policies can be linked. They can refer to one another, but it makes me feel less lonely writing a policy because I have to talk to other people and communicate. And for someone who's a social nerd, I like that communication. Hey, what direction are you taking this policy? And the good thing is, for again, the areas where I tend to dwell, I have starting points. I have a bulletin. I have a notice. I have an annual agreement. I have a legislative notice that came from the state legislature. I have the Medicare final rule. I have something where I can just drag and drop and copy paste some of it And then, I'm going to take it to my review committee. I'm not going to do it in a bubble all by myself. I'm going to share my policy, and then I'm going to communicate my policy. I'm going to tell people, hey, we now have this policy. Take a look at it. Make sure it's working for you. If it's not working, let me know. Let's revise it. Let's keep it living and breathing and not static. So I think policies and procedures are a great roadmap, a great blueprint, but it also keeps people engaged if they're used properly.
All right. So, folks, this is why there are 3 of us for all the different perspectives. So clearly, Lorie's very passionate about policies and procedures. Remember that. It might be a good mental note to have for the future. Me, believe it or not, and I don't know what this says about me, I really love auditing and monitoring, and I love training. Now, why? Why do I love it? Let's start with auditing and monitoring. I suppose part of it is that I like the puzzle that auditing brings, right? So you're setting the scope of the audit, you're speaking with people. If you're lucky or the audit includes it, you get to interview people, you get to learn how a part of the organization works. And you're maybe looking through documentation. I mean, I like it. It gives me some people time and some alone time. There's something very relaxing about going through documentation and developing tools and figuring out, are there any gaps? Are there any risks? There's just something, I don't know. I find it really relaxing. I enjoy it. And then being able to communicate those risks with the business partner, as Lorie would call them, and then being able to work with them to come up with a plan of how to address. And we talked a little bit about, compliance being seen as a no. I actually don't see compliance that way. I see compliance as a way of, okay, well, let's figure out how. There isn't a no. So if the audit throws up an issue and there are challenges, then there will be, that are contributing to those particular gaps and risks that the audit has identified. It's an opportunity to work with your colleagues and your business partners to come up with a plan. And I find that to be very creative. And I feel then that I'm helping my colleagues and I'm helping the business, because maybe, they need someone to see the issue from a different perspective. And that's really cool. I feel like I'm now part of my organization and not just this lonely compliance person doing my thing. So I suppose that's really why I love auditing and monitoring. I love investigations. That's all part of it. And I love training because I genuinely love teaching. I get to meet the newbies to the organization. I get to meet, the old schoolers. I get to work with them. I get to share information and I get to answer their questions and get to know people. I get to understand what's puzzling them, confusing them, and it teaches me how to explain information differently. I get to do coaching and mentoring, and it's about a field that I love, compliance, and it helps me stay a bit more grounded, because I'm not just looking and speaking regulatory speak and not just looking at risks. I'm actually working with people to help them understand why compliance is so important in their language, and maybe understanding how is compliance and the regulations important to a specific aspect of someone's work. And so I really love it. I love hearing back from people, and I love hearing, well, what if, or I'm a little bit confused, or can you clarify? Like, it's really pretty amazing. And when you get to see people get it and they're like, oh, oh, okay, that's all right. I can do that. Or now I understand why I've been asked to do a particular thing. I don't know. I think that's really brilliant. And knowing that, as a teacher, as a trainer, people will recognize you as maybe a safe source, a safe harbor. And if they need to raise compliance issues, they will feel more comfortable coming and speaking to this person who acted as that teacher, that mentor, that guide. I think is really important for an organization and a strong compliance program. So I don't know. I think the training and the education is just exciting, and the puzzle of developing a curriculum or a training program, and there's so many different things you can do and so many different learning styles. Again, you're continuously challenged. So that's my long version, but you both know I love healthcare compliance, so I could probably go on and on about each element and why I love it. But those are the two that I really love the most, that bring me the most joy, I suppose.
So I asked this before to you, and I want to ask it for the show's sake. Which way do you prefer? Education, auditing, education, basically sandwiching, auditing in the middle? Or would you prefer, even in with your company right now, would you prefer to go blind, do your auditing, see the material at hand, and create an education based on that?
So that's a great question, and one that does come up. And I think my answer to you would say it depends. I sound like an attorney. It depends on the situation, right? If there's an opportunity, it would be great to do education and then audit, and then to see if the education really took, right? And then if there are still gaps and there's still learning to be had, you develop a plan, right? But sometimes that doesn't always happen. There's a crisis, or there's an investigation, or something has come up and you've got to audit. You've got to do the audit and then pull out the education. For example, it might be, and also, maybe you're new to the organization. Maybe you're a new compliance team to the organization. You don't even know where you stand. So
Yeah.
you want to get a baseline. So you do an audit just to get a baseline and to identify what education and learning and training you need to put out there. So really, it depends. I suppose in an ideal world, if I was starting an organization myself or a team myself, I would do the training, then audit, and then train, and then just have, a bit of a continuous cycle. But I'm not sure every day that that's possible to do, especially when, for example, as a compliance team, you might have an audit plan for the year. So, you're supposed to have some sort of audit plan, and you've got to kind of stick with it and juggle anything else that might come up and maybe make some adjustments. So I think it's a really great question, but a tough one. How would you approach it? Do you have a sense?
I was just thinking when you were talking about when you come into a new organization, because there was a period where I was new to the role, and the role was new to the company that hired me, the specific niche and the vertical. And I remember thinking, okay, they have the trainings in place. I see the attendance, I see the statistics, but then I'm also looking at the consistent problematic areas, and I'm like, okay, then people who are attending, it's not, then the education is not effective. Then I need to change the education here, because if it was effective, we wouldn't have this problem.
Yes, that comes up. I think that's a good point to make.
Yeah, I think you have to be very flexible in education as well, because some departments are departments that you give them the material, they say thank you, and they automatically incorporate it, and they're running with it, and they come to you with questions. So you don't really have to do the knowledge check the same way as there's some other teams that maybe they're the last ones to adopt, or they're adoption resistant. And so then,
Adoption resistant. I will be using this.
they are. And so you're in the situation where they need to know the information. They have to adopt it. They don't want to. And so you need to educate them why. What's their why? It's, we ask that question a lot in business and in organizations. What's our why? I think for compliance, it's what's your why? Why should you want to adopt this regulation besides the legislature and the governor say you have to? Or HHS or OIG or CMS or whatever alphabet entity says you have to. You have to make it personal on some level. And so there's a lot of customization, I think, that goes with training and education.
Yeah.
Agreed.
I think about
Agreed.
boards in particular.
Yes.
That can be a tricky area, but we can save
Yes.
that for another podcast, how to interact with your board.
Yes.
Elvan, but how
Yes.
about you? What's your favorite element?
I think for me, you ladies are kind ladies. I fall to the bottom of the list. And I think I gravitate towards enforcement, disciplinary guidelines, and prompt response, corrective action, all of that. There's an amazing book out there from Ken Coleman. It's called Do the Work You're Wired to Do. And this is definitely from a compliance perspective. That is what I am wired to do. I can be very consistent in my response, my timeliness, and the type of response, the amount of consequences. I find myself excelling in this part of compliance, being consistent and fair across the board, enforcing the compliance program and the rules and regulations. So I think I gravitate towards those. Again, mainly because if you ask me to write a policy, this is how it would go. Over there, Lorie is reading, interpreting, thinking about all the variables, putting in pen to paper, doing it. Elvan's like this. Use common sense. Also, do not call me after 8 p.m.
Oh,
So
oh,
Elvan, do you want to know what Lorie Davis's favorite phrase is in the whole
What?
world?
oh
The
my
only
God.
thing more common than hydrogen is stupidity. And
Not,
if I could put that in policies, I would, but I can't. So
you just can't. You just can't. They
I
take
have to
frown
be
upon
more
stuff like
sunshine
this.
but I have to be more sunshine rainbows. So
I know. I'm searching for my sunshine and rainbows, and I think it's just I gravitate towards those because of that. Because I don't have the patience to write out the policy and procedure. I appreciate it, like you said, just I like having it there. I like people keeping it up. I like it when I look at the policy and procedure that, it has the effective as of date at the bottom and it's as present as reasonably possible. I like that. I like somebody doing the auditing and me looking at the bottom of the results and saying, okay, this is where we're at. To me, that's my, okay, this is my little marker as to where we're at. And now I have an idea as to where I want to go to. So I like those pieces. Training, I'm a good mentor on a one-on-one in explaining things. And then I go from that one-on-one, excelling at that one-on-one to really, really big, broad subjects, which then, you're doing these trainings to 1,000 or 2,000 people. So it's a lot more broad. So, but I find myself really not having the passion for that middle ground, kind of broad, but kind of specific. So
Well, it can be
yeah.
hard. It's hard. You're trying to target your training at the right audience or at the audience in front of you, right? And that can be really difficult. Like that's a challenge.
And I think a part of why I like the disciplinary action and corrective actions and all of that, I think a part of it is because I really like to work with HR and operations. And I can plug myself in. I can plug myself into HR and say, hey guys, these are the recommendations I have. Hey, operations, we can follow this recommendation as a result. These are the risks and benefits of that recommendation. We have an alternative one. Here are the risks and benefits of that. And again, going back to that consistency, and I get to say, however, just an FYI, within the last year or two, we've had 5 of these incidences, and this is how we responded to all of those. So I like being able to create that consistency and fairness and have my fingertips in HR and operations and have that influence from that perspective. And I bet there is a little bit of my, not just that it's a fit for my personality, but I bet there's a little bit of that narcissism because people listen to you, right? When you bring them an investigation and say, here are the results, here are my findings, here are statistical answers, and you get people's attention. And my hope, most of the time is that after, let's say that we take 2 of these disciplinary actions consistently across the board, that somebody in operations, before they turn a blind eye for the 3rd time, they think
Yeah.
twice.
Yeah, I see where you're coming from. I often see corrective action as problems you can fix, right? You didn't know you had a problem. Now you have a problem and you can fix. With the code of conduct and you get into that disciplinary, that's a little bit different than a
Mm-hmm.
corrective action where, oops, we
Yeah.
found a problem. And again, the policies can help you because that's another tool that you can use in your arsenal when you're going with corrective action or a disciplinary action. I am fortunate that I haven't had to deal with a lot of disciplinary actions, but the code of conduct was there to support us and help us. And we partnered with HR,
Mm-hmm.
we partnered with legal to make sure everyone understood. And then we could roll it out and we kept it updated. And we had that as well for our vendors so that they were on board and they knew what was expected. So I get where you're coming from,
Mm-hmm.
but I also remind myself how they're all linked together.
Oh yeah, it takes
And
all of
I'm
us.
and that is, and I'm more, I understand where Alvan's coming from. It's not, my strongest area. I think I'm too touchy feely with people, but it is part of the job and being a compliance officer and a compliance professional. And unfortunately, I have been involved with a lot of, disciplinary action and working with HR and legal
Mm-hmm.
to ensure a consistent disciplinary policy, and applying some sort of monitoring, of course, is tricky, right? Because these are HR issues. But still, I find that a lot of organizations, they aren't looking at whether they're consistent. They really aren't, and there are many reasons for that, right? But compliance does have a role in saying, okay, well, what are disciplinary responses to certain activities? Do we have the policies and procedures to back that up? And then are we demonstrating consistency? And that's not just important for, compliance. It's important for a business to demonstrate consistency, because you don't want to wind up in court or a tribunal, or, knock on wood, if you have an employee that was let go, they come back to you and say, well, you treated us differently, or you didn't follow your policy, or my dismissal was
Mm-hmm.
unfair. So there's a lot more going on than just compliance. And I don't think organizations realize that. They have disciplinary policies, but where they fail is showing the consistency.
And I think corrective action, I think we need to talk a little bit about that, where corrective action doesn't always mean per person.
Yes.
If you've done
Correct.
disciplinary actions across the board for the same behavior, same consequences, then you still need to look back quarter by quarter, year over year, and say, hey, we have a system-wide problem. Yes, no, those people are no longer with us, but we need to turn the mirror to ourselves and accept the fact that clearly we have a messaging problem. If we
Yes.
didn't have a messaging problem, if we didn't have a policy problem, if we didn't have an education and training problem, we wouldn't see this many of the same infarctions where we had to take these disciplinary actions. So what are we going to do as a then organization to say, okay, we need to come up with a corrective action, and it applies to everyone. Everybody has a piece of the accountability, from the
And
C-suite to the field.
yeah, and again, I think that's where policies and procedures and effective communication can come in and really be your hand here, right? If there's a policy, has everybody attested that
Mm-hmm.
they've read it and acknowledged it? Maybe you need to do a knowledge check on that policy and procedure. Maybe
Mm-hmm.
it needs some feedback. Hey, this is why it's not working. That's why we're having the same issue over and over. But that effective communication, Elvan, is so crucial.
Mm-hmm.
And reminding everyone that compliance is everybody's job. It's not just compliance's job. It's everybody in the organization's job. And that's where effective communication can really come in here.
Isn't it insane to think that we're having to say compliance is everybody's job? I don't walk out my door and nobody has to tell me, hey, today, Elvan, law applies to you. I assume that law applies, traffic laws apply to me as soon as I turn on the ignition. And hopefully one day we're going to get there, organization per organization, about compliance like that. It's everybody's job. It's like saying, do we choose to have integrity today or not? No, that's a given. You're going to wake up with it.
But maybe that goes back to how compliance is perceived. It's perceived as an other. It's perceived as separate.
Yes.
It's perceived as something to be afraid of. Whereas I say, well, hold up. Use compliance number one. Leverage it. Leverage compliance. It is actually good for business. There are certain circumstances where it's actually good for business. Do it not because it's a regulatory issue. Do it because it is common sense. It is good for your business. So just going back to that consistency about disciplinary measures, but it's good for your business. It protects you. It's got nothing to do, or even I tell people around HIPAA and cybersecurity, don't put it's not all about HIPAA. In today's day, in today's day and age, your cybersecurity program, you want that in place not because of HIPAA, but because you need it. It has nothing to do with HIPAA. Do you want to lose your company data? Do you want to lose your sensitive data? Do you want that to be compromised by somebody? Do you want to have to pay ransomware? HIPAA is just like a byproduct. In that case, I mean, not everyone might agree with how I
if
put
your
that, but
private information went out there and your coworkers knew it? Are you ready for your HNP to be printed on a 20 by 20 page and put it on the wall? If the answer is a no, because the answer is a no for me.
people don't always think that way. Organizations don't always think that way. They may have other goals and priorities, but I think that until organizations realize that compliance really is embedded in everything they do, it's not something else, people will have a hard time. And they also don't always understand what compliance is. So, you might be member services staff and you are doing compliance every single day. And yet you might turn around and say, oh, that compliance team, actually, believe it or not, you're part of that compliance. It's not something separate from you. It's something you're already doing. And I don't believe most organizations quite see it that way or communicate compliance in that way, which is why people think it's something other. Right?
Totally agree. Compliance, it starts with the tone with the top and all the way down. Everyone in that organization, and we have to make sure that the C-suite knows to say that, hey, compliance is everyone's job, and it should be in every compliance training, everything we do. People should know compliance isn't just me. It isn't
There's
just
one element we haven't talked, because clearly it's nobody's favorite, about the compliance leadership on the 7 elements. But it is the C-suite's job, to the point that you're making, Lorie, to message that out. It is almost, I even think that it is the CEO's or the COO's job to say, guess what? No, compliance does not report to me.
I see what you mean. Yeah. It's everyone's job.
It's everyone's job. And no, they're independent. No, don't think your team, my team, that team, they're independent. And I do give them independence. No, compliance officers don't pull for me. They don't protect me. They protect everyone. So I do see that there needs to be, that's why that element is so important, that it needs to be kind of like a self-cleaning oven. A self-cleaning oven does not need outside agents to operate. It just self-cleans. It's, and that's why we need the compliance leadership and oversight. And for that person in that role to have not only high integrity, but the confidence and contentment to make decisions, related decisions, communicate effectively, and to have the C-suite support and messaging backing that up.
There is that. I've had a lot of people look at me and say, well, you're obviously, you're responsible for compliance. And that goes back to our, leading conversation about everybody being responsible for compliance. But actually, if you're leading compliance, you're not responsible for doing all of the compliance, and you're not responsible entirely by yourself as a compliance professional for compliance across an organization. You have a fixed job, and that's to make sure that you're not even making sure, but to test, to find mechanisms for identifying risks and risks of non-compliance. That's really your job as a compliance department, right? And that has to be communicated, I think, from the top down. Hey, no, the compliance function isn't responsible for all of compliance. They're here to test whether we're compliant and to help us identify where we've got a problem and work with us to understand how to go forward. And I don't really think that happens often enough, or certainly not as often as I would like.
Yeah.
Okay, ladies, I don't know what we did, but we breezed through an hour's worth of conversation. Hopefully, listeners, hopefully you've enjoyed the discussion and you've, gained some insights, or even, you could nod your head and say, yeah, I recognize those issues. They apply to me. But hopefully you found it interesting and you're able to take something away from this podcast episode. I suppose if I had to sum it up, right? And ladies, interject, please, or disagree in any way. But the truth is, a compliance professional and a compliance officer comes in all different shapes and sizes. We all have our strengths and our weaknesses. We all have our preferences, right? I mean, the role is complicated and requires varied skill sets, right? And you do a little bit of everything, if I'm honest. But the truth is, yeah, we have different, strengths and different preferences and aspects of our job that we may enjoy more than others. And it's okay. I think that this is a strength for those organizations where you're a department of one. It's okay. You're going to do the best that you can. There's a way of handling it. For those of us who have a team of compliance professionals working for us, or multiple teams, you have people, again, that's what makes a very strong compliance department, I think, a very effective. The fact that we do have very different strengths. I love it, Elvan, that you're more comfortable around enforcement, and I can understand why. I know that I do it. I can do it. And I'm very professional about it, and I work with other partners. But it's not my favorite aspect of the job. I mean, who likes, and you won't either, who likes to terminate somebody? I'm not saying that you like it. That's not what you like, but the whole thing does make me a bit anxious. I still have to do it, right? And Lorie, same, policies and procedures. I write them all the time, and I like the end product. I like the fact that there's a sense of accomplishment, but it's not my favorite element, right? But that's okay. That's a really great thing. That's just part of being human. So folks who are listening, I hope you'll take that away. We are on the spot. We do what we can with our preferences and the resources that we have and the knowledge that we have. And we look forward to each day and do the best we can. And that's all right. If you find yourselves in the same position, it's okay. Work on developing your skills, your strengths. And if you have areas where you don't feel so confident, see if you can kind of bolster your expertise in that area. Or do you have colleagues who maybe their strength complements your strengths, but they're different? Anything else to add, ladies, before we go?
I think you've summed it up great.
Yeah, great summary. And I think you need to lean into what you like, but not ignore the other elements. And there are great resources out there to help you and colleagues and professionals and reach out to us. We'd
Mhm.
love to hear what everyone's favorite element is.
Yes.
And how you tackle those and how you make the ones you don't like more bearable. You might have some strategy that to make me like enforcement more than maybe I do. So I'd love to hear that.
Oh, I agree 100%. You have a question, ask away. There's nothing wrong with raising your hand and saying, I don't know, I'm uncertain, and I'm uncomfortable. It's much better to say it than to live with a decision that you later think, coulda, woulda, shoulda.
And this is why I love these ladies. Yet another reason. You'll hear that quite a lot throughout these podcasts. I totally should have mentioned, we'd love to hear from you. We'd love to have your questions. And we're happy to try and address them through our podcast. I'm
Mhm.
not saying we'll get to every single one, but we will respond in one way or another. And if there's, a particular question that we should explore, we feel that is worth exploring more widely on the podcast, we'd really love to hear from you and explore that particular issue or that question. So please do get in touch. Love to hear what you think. Love to hear if you have any clarifications. And that would also help our audience. If there's something you feel we missed or would complement our discussion, share it. We'd love to hear it. And other compliance professionals would love to hear it as well. So on that note, ladies, I think we should end, and
Sounds
we'll see
good.
each other next week.
See you
Adios
soon.
to this.